Hi, good afternoon to you all, or good morning. Greetings to all our foster grandparents, senior companion volunteers. Happy New Year to you all. I'm sorry I am not able to attend personally because I'm out on vacation, but I thought I would still share some knowledge with you guys through video. So hopefully this will this will be able to help you. So now I'm going to be sharing a screen with you guys. I thought it'd be nice to discuss what happened this past 2 years, how to keep yourself safe. So we'll discuss more about COVID and COVID-19 then and now. My name is Dr. Claire Lazaro. I'm the clinical director at VMRC. Welcome to everyone. Okay, so basically, there's three major topics that we are going to be talking about. When everything started, what happened, and what to expect now and in the possibly near future. So everything really started back in 2020. January 20th was the day when there was a first confirmed case of COVID-19 here in the United States. It was specifically there at the state of Washington. At that time, there were a few cases detected back as early as January 15th, and then started to really climb up February until March. March is when we had the first lockdown or stay at home. And the state of California was actually the first one who did that. So what happened then is, of course, what we have been enduring now for the past 2 years is COVID-19. COVID-19 is the name of the disease. The virus is called SARS-CoV-2. And this virus comes from a family or group of viruses, which is called coronaviruses. So they're called coronaviruses because they have these things. These are called the spike proteins that are around them and protruding out that kind of like gives them that crown-like appearance. That's why they're called coronaviruses. These spike proteins are very important also because these are the attachment way, the way that they attach to our cells, and these are also the things that usually change when they have new variants or mutations, which I'm sure you have all heard as well. So we've talked about staying at home at the beginning and then eventually getting that restriction lifted out. We all had to do that, and not just here in our country, but also all over the world. Really, it affected all over the world. And then there came also the mask mandates. There are people who are in favor of it. There are people who are not in favor of it. But really, when you look at the science of it all, there's a lot of studies now that have shown that wearing masks are very helpful and they protect you and also the other people around you. Another way is because the mask, when you wear masks, if you're, for example, not sick and you're wearing masks, it lessens the possibility that you will inhale any particles of the viruses around the air. Because as we all know, now it has also been recognized that it's also present in the air through aerosol transmission, airborne transmission. So it's there. So that's why if you have a mask, that also helps lower the amount of virus particles that you could inhale that could go into your body, into your system. So it doesn't just protect other people from you not sharing the virus. If, for example, you're sick or you are infected, but you have no symptoms, but it also protects you and those other people that are really not infected, but then just wanting to go around and do their business. Of course, washing our hands. We are really promoting hand washing for at least 20 seconds if there is an available soap and water. If there's no soap and water available, your handy dandy hand sanitizer As long as there's at least 65% of alcohol in there, then it's going to be helpful to kill those germs. Physical distancing is another way that we have all heard. So when we're doing all these measures, it's not just picking one or the other. All of these are supposed to be together, helping you and protecting you from getting sick of COVID-19. It's not just, oh, okay, I'm far away anyway, it's okay. If you're outdoors, then it's okay to like have physical distancing and then eat. That's why there's also this mandate before that there are lesser risks when you are eating outdoors because you have to take off your mask, but at least there's that free flowing air around you. But really, even the World Health Organizations, they are recommending that all these measures are used together and not just picking one over the other. Right now, we are very fortunate to have our vaccines that first came out in December of 2020, prioritizing the vulnerable population and healthcare workers. Also, we now have the boosters. So with everything that's going on, new variants that are coming out, getting the booster is going to be an added layer of protection for you. This is our still #1 line of defense against the coronavirus SARS-CoV-2. It's really getting your vaccine. Get the vaccine that is available to you. And if you have had your vaccine 6 months ago, if it's Pfizer and Moderna, you've had that 6 months ago, then get your booster shot now. If you've had J&J before, you should get another shot 2 months after. Most recently, the CDC and the Food and Drug Administration actually have given an updated guidance as to which vaccine would be the preferred one. So they are now saying that if there is a choice between Moderna or Pfizer, those two are both mRNA vaccines and they're almost very similar to each other. Those two versus the Johnson & Johnson, Janssen or JNA vaccine, then the preference would be leaning towards Moderna or Pfizer, especially if you have had history of blood clots, thrombosis, then the more that you would want to get either Moderna or Pfizer. They have also given us the guidance of mix and match of the vaccines. So for example, if you have first gotten the Pfizer for your first dose and your second dose, and then for the booster, the one that's available is Moderna, you could get the Moderna for that. And also vice versa. If you were fully immunized with Moderna and then you wanted to get the booster, you could get the Pfizer vaccine or booster for that. Also, if you're not aware, it is now approved for children 5 years old. Used to be that it's only for 12 years old and up, but now it's also approved for 5 years old to 11 years old. That is the Pfizer vaccine that's approved for that. So that's really good. Just wanted to share what VMRC have done through the past year, really encouraging vaccination, a lot of collaboration with the county public health offices, and also health advisories to give you guidance on the importance of vaccine, our service coordinators contacting consumers. We've also had our vaccine clinics, drive-through clinic, and that is through partnership with Safeway. And then our care homes have partnered with, well, it's actually the state have partnered with CVS Walgreens through this pharmacy partnership program, that these pharmacies were able to go to care homes and provide vaccines to our consumers. So everything that has happened after all of that we know, what are we going to expect now and in the future? It's now 2022. But really, we are still in the pandemic, although it's getting better. Number one, because we have the vaccine, and number two, just today, it's actually, I am recording this now, it's December 22, and I just got notification that FDA just approved the first COVID pill that could be taken in the home. So there's really a lot of new developments with COVID. So what else are we supposed to expect? Well, as responsible citizens, we really would want to follow and track what's happening. Right now, as I've mentioned, this is right now, I'm recording it in December of 2021. The cases are still trending up, and this is because of this is a combination of still the Delta variant and the rising Omicron variant that we have now. The January surge here. So this graph that you're seeing, this graph is the cases of COVID in the United States from January 2020. So it was initially just around 50,000, climbed way up, especially around winter of 2021. This was the surge of the Delta variant. We were able to control it, and also with the help of the vaccines, we were all able to help control it. But then again, starting to surge. This August surge was still the Delta variant. And then now this new surge in winter is a combination of the Delta and the Omicron variant. So we really want to be in the know of what's happening and keep track of what's happening in our country. Another good source for you to look at in trying to keep updated is the CDC COVID Tracker. So in here, as of December 21st, they are showing that we've had a total of over 51 million cases with a rate of 314.9 per 100,000 individuals. Unfortunately, COVID has cost over 800,000 lives already, and that's over 800,000 families that have been affected by this devastating pandemic. Another nice source, which I really, for me personally, I use this a lot, is the Johns Hopkins University COVID Tracker. I like this because they map out the whole world, really. You could see and you could visually see, and for me, I feel that it is really all over the world. It's not just here. We're not like, you really cannot say that, oh, I am safe, I'm isolated. No, because of all the industrialization and globalization that has happened, it's the travel going from one place to another, it's so easy, and with all the advantages that it also has a disadvantage of easy transmission of diseases that are coming from other places. And in this case, the variants, the Omicron variant is the one that we are latest experiencing lately. This one they have updated, not just giving you the number of cases all over the world and the number of deaths all over the world, but also they have updated it, including here number of vaccines that have been administered all over the world. Really, for us to end this pandemic, we really need to vaccinate not just our country, but also other countries around the globe. Now going back locally in our little niche of the world here, as this data is as of December 17. So as of December 17, you'll see this in our 90th health advisory. We have had 1,041 positive consumer cases since the beginning of the pandemic and 65 deaths, 38 VMRC staff cases, 4 volunteer cases. This one, it's the same number actually since June of 2021. So that's good. I'm happy that our volunteers, you guys are our volunteers, didn't have any more new cases. So that's really promising. It means you guys are taking care of yourselves and being safe and healthy. And then the providers, our vendors, we have had about 482 positive cases, and unfortunately, one of our vendor passed away because of COVID. We were talking about variants a while ago. I have mentioned about Delta and Omicron. So are they the only variants that are there? Why do COVID-19 have variants? So quickly, as we recall, I've shown you a while ago the picture of the coronavirus where it has those kind of like spikes, like a corona around it, like that. So those spikes are the ones that are kind of like changing in the genetic information and mutating. So the CDC and the World Health Organization has classified these variants into 4 different classifications. One is the variant being monitored. So as of now, there's 10 variants being monitored. There's alpha, there's beta, there's epsilon, there's gamma, and other names there and numbers. They know that these variants are there. As of now, they don't see that they are causing much trouble. So that's why they are just being monitored, because the coronavirus is novel and everything is new. So that's why they're just keeping an eye on these variants. Now, when one is called a variant of interest, this one, there used to be more of these variant of interest because at first they thought that these variants would have, back in July, there used to be 7 here and there was no variant being monitored. So all of what happened was all of the variants of interest, those that they think could have a possibility of having more spread and possibly avoiding, possibly affecting immunity. That's why they call it a variant of interest. So those variants of interest right now, they have moved into that variant being monitored. So basically they have lowered their level, which is good. It means they're not really causing any harm. So after the variant of interest, which right now we don't have any, there's the variant of concern. The variant of concern are the variants that we have seen evidence of EC transmissibility, meaning it moves from one person to another very quick. It spreads fast. It spreads rapidly. There's also a chance of that avoiding our immunity, avoiding the vaccine, avoiding the passive antibodies that are being given to patients as part of the treatment, or the monoclonal antibodies. So that's why they are a variant of concern. Right now, we have talked about those 2 variants of concern. That is the Delta variant, which have caused our surge back in winter and also in August. And now also, again, during this winter. And also the Omicron variant, which we have discovered, well, not me, it's I'm sorry about my dog. Okay, he's gone. So the Omicron variant have been discovered by our by scientists from Africa, South Africa, back in during Thanksgiving. So one thing we really don't want to happen is the variant of high consequence, because this variant, when a variant is classified as to high consequence, it means they are definitely causing more severe diseases and increased hospitalizations. So we don't want that. Hopefully, we will be able to get more people vaccinated and avoid providing opportunity to the virus from jumping from one person to another. Because when the virus has that opportunity to jump from one person to another, that is really where most of these mutations happen. And when there's a lot of mutation, eventually a variant is produced. So going to our next slide. These are general information about the vaccines, which I thought I'd share. Most of you have probably seen this before. It's showing how the efficacy of Pfizer and Moderna is. Pfizer is 95%, Moderna is 94%, J&J is about 67%. At that time, we were really telling people that we want to get the vaccine that is available. But as I've mentioned to you guys, CDC has just recently, this December, given a new guidance wherein if you have a choice when you go to your pharmacy or your doctor's offices, when there is a choice between an mRNA vaccine, which is the Pfizer and the Moderna, they are both mRNA vaccines, versus J&J, then the preference or recommendation would move towards Pfizer and Moderna, especially if you have history of blood clots or thrombotic illnesses. Though, just to reiterate, you are fully vaccinated 2 weeks after the second dose of either Pfizer or Moderna, or 2 weeks after the first dose of the J&J. Meaning, after you've gotten your vaccine, like if, for example, I've gotten my last dose right now, I'm still not fully protected. I'm not at these levels that are in here. It means that there is still a possibility that I could get sick because of that, because I'm fully protected 2 weeks after those doses. Having said that, if you will look at the numbers, again, it's not 100% protection. So there are small percentages, but those are small risks that are available that we're willing to take, as these are really still excellent numbers. Because we have had the vaccine for quite some time now, a year, there are studies now on the real world effectiveness of our mRNA vaccine, and it is showing that it is preventing hospitalization up to 96%. So that's really excellent. We should all remember that the goal of these vaccines is not, it doesn't protect you from getting the virus at all, but what it does is really it protects you from getting severe illness, from getting really, really sick and getting hospitalized because of the vaccine. It protects you from dying because of COVID-19. So we have mentioned there's over 800,000 people already that have died because of COVID. So that is the goal of the vaccine, is to avoid those severe cases, avoid hospitalization, avoid death. And as Dr. Walensky, the CDC director, has mentioned, 99.5% of deaths right now from COVID-19 are from unvaccinated individuals. So we really cannot emphasize more the importance of getting your vaccine. And if you have been vaccinated already, get your booster shots now, especially with the Omicron variant. There are new studies that with just the two vaccines, the two doses, it's not that effective. But if you have a booster shot, it definitely raises the bar of your immunity and thus protecting you from the Omicron variant. Oh, I went ahead of myself. This was what I was discussing to you guys. Vaccines are effective and that it protects you from severe COVID-19, protects you from getting hospitalized, protects you from dying of COVID. So definitely get your vaccine. If you've gotten your vaccine, get your booster shot now. CDC guidelines. So CDC guidelines are kind of like there for us, but also we have to remember that each state has also their own guidelines. The local, the state public health offices, and also each county have their own local county public health offices. So for example, CDC before have given guidance as to how people that are vaccinated and unvaccinated could mingle together. If you're on the same household, of course, definitely you mingle together. If you're going to be mingling with another household that are also fully vaccinated, then you guys could get together without wearing masks. If there are people that are not vaccinated, and especially if they live with people that are immunocompromised, then it's advisable that you wear masks. Another guidance that was given before was about indoor and outdoor when to wear a mask. So for those that are vaccinated, it is okay and safer for you guys to not wear a mask when you're outdoors. The most recent recommendation here in California is that if you are going to go indoors in public areas like restaurants, grocery stores, that you wear a mask because of the increase in cases again. And we're hoping that that will help prevent more increase, especially during the holidays. So we'll see, because that mandate is effective until the 15th of January. The risk tolerance and risk aversion is related to the wearing masks. Also, so how it's basically deciding for yourself, how much risk am I willing to tolerate? And what is my own vulnerability, or what is my own risk? Am I elderly? Do I have comorbid illness? Do I have diabetes? Do I have lung problems? Do I have severe asthma? And then going to public areas, or just even in the open space, am I okay to take the risk of not wearing a mask? Or would I feel better and safer wearing a mask because of those risks that I have in myself, and then exposing myself also going out to the community? The same way, risk aversion, do I want to avoid going to public places? Do I want to avoid going to, for example, watching a ball game, watching a movie? Do I want to avoid that for now, just because of my own risk as well? Am I that healthy or not? Am I vaccinated or not? Do I live with people that are immunocompromised or vulnerable to getting severe COVID? So should I avoid doing some other activities that would put me at more risk, or put my family member at increased risk? Because remember, whatever I get or you get when you go out in the public, you bring it home to your family, to your household, and they will basically get exposed because of whatever activity that you have done, and vice versa, they will do that to you as well. So that is what this risk tolerance, risk aversion is what are you willing to tolerate, and what are you willing to do or avoid based on your risk as well. So depending on that, you could decide whether you want to wear a mask or not in certain situations. Remember, there is no law against wearing masks, so everyone is okay to wear a mask whether it's required or not. You're not going to be told, hey, you don't have to wear a mask, you remove your mask. No, there's nothing like that, because everybody can wear a mask if they want to, for their own protection. Another layer of protection that will remain is, of course, washing your hands for at least 20 seconds and really scrubbing all the way to the in between your fingers, all there in between those thumb. See how this scrub is trying to scrub your fingertips here, doing all of that. That is really important to do that for 20 seconds so that all the viruses, bacteria will go away. It's because remember, it's the friction. It's that act of rubbing, that friction that happens, that is the one that really cleans up and washes away the bacteria, the viruses that are in your hands, invisible, and we do not see with our naked eye. And again, I'll remind you all, if there is no soap and water available, then you could use your hand sanitizer and do the steps again, because it is really that friction, the rubbing, that helps remove that. And especially when it's a hand sanitizer, don't make your hands wet and then get a paper towel and dry it up. No, have it dry in your own hand, because all that friction and the act of it drying away, that helps kill the bacteria, the viruses in your hands. And of course, masks. We were just talking about masks a while ago. There are people who are not sure when they have the surgical masks, that there's color, there's a blue and a white. How do they wear it? So the right way of wearing that is that the colored side will be out, and the white one is the one that is touching your face. Okay, so the correct way to do that is the color blue would be outside and the white side would be the one touching your face. And of course, again, we've mentioned about keeping our distances 6 feet as much as we can, especially if when you're eating and there are people that are not part of your household that would be there, because you don't know where they've been and what they've been exposed to. So that's really another layer of protection. And I've mentioned about avoiding crowds, you know, watching movies. I know a lot of you may go to grocery store. One way of avoiding crowds when you need to grocery store is either order online or go very early in the morning when the grocery store just opened. There's very few people there, so you're definitely avoiding the crowd that way. One thing I want you all to remember with the new year, lots of New Year's resolution, this is a very good thing to have, is self-care. So I have here just wanting to emphasize self-care or caring for yourself is not being selfish. It's actually loving yourself. The more you care for yourself, the more you will be able to care and help others. Because really, if you're not feeling well, you won't be able to help other people. So you have to take care of yourself so that you'll be able to care for others. That's why self-care is not selfish. It is really an act of self-love. So how do you do that? You eat healthy fruits and vegetables, less processed foods. If you can cook it yourself, the better. Another way of looking at that is when you read the ingredients of the products that you buy, if there are a lot of things there in the ingredients that you really cannot read and you cannot understand, then it means it's very processed. Try to find things that you really know it's whole foods, like if it's just sugar and the fruit, then you know it's more of a whole food and it's healthier that way. And then also physical activity. So physical activity doesn't really mean just that you have to be in an exercise program or attend the gym every single day. It doesn't have to be that way. Not everybody can afford that or have the time to do that. Physical activity is as simple as walking. It could be as simple as gardening, or if you like to dance, even if it's just a slow dance, doesn't have to be the vigorous ones. Those simple activities can definitely help you be healthier. A lot of studies have been done in older populations that if they have a lot of physical activity, even if it's just during their leisure time, well, especially during their leisure time, and it's called leisure time physical activity, the more that they have that, the better is their health, lesser cardiovascular risk, lesser risk for diabetes, greater bone density. So, you know, as we older, our bones become more brittle. So the more bone density they have, if they have a lot of physical activity. So all of those simple activities that you do every single day, that helps. And also another thing that they have added on in the past decade in those studies for older population is avoiding sedentary lifestyle. So what does this mean, avoiding sedentary lifestyle? So this means that all throughout the day, the more that you are standing up or even just walking, the better, compared to people who are sitting down or laying down most of the day. That's why a lot of you would hear a lot of people including pedometers or accelerometers that monitors your activity. Even the smartwatches have that. They will give you an alert, hey, it's time to stand up. You haven't stand up. At least having 2 minutes every hour of standing up and walking around your home would be helpful. So that is another way of maintaining yourself, being healthier and avoiding the risks that you have on being sedentary, which is a lot of risk for heart attack, stroke, cardiovascular risks, all those things. Another way of caring for yourself is what you call caring for our mental health also, and spiritual health. So there are things that you can do: mindfulness, deep breathing. Some people do yoga. Prayer is definitely one too. Some do praise and worship, singing. A lot of other things that could help you. Some people use app, like there's what you call Calm. That's an app that helps you meditate or be mindful. There's also Headspace. There's also an app called Timer. So there's a lot of things that could help you as well. Making sure that you kind of like ground yourself, and that you are taking time to focus on yourself. Even just like deep breathing and focusing just on your breathing for like 2 minutes a day. That goes a long way, because there are studies that when you take a deep breath, our body releases this substance called nitric oxide, and it helps lower our blood pressure because it kind of like helps dilate our blood vessels. So even that simple act of deep breathing helps you in your blood pressure, in your cardiovascular health. That would also help lessen the risk for stroke. So really, all of these things together, healthy foods, being active, mindfulness, all of these things would make you a healthier, better person, will be more energetic and doing self-care. And hence, I know you're volunteering because you like to care for others. Then you'll be able to care for others more if you are doing your self-care. So that will be all for me, everyone. I hope you like my presentation. I'm sorry I'm not available to do question and answer, but if you do have some questions, feel free to email me or send your questions through Chrissy or Sarah, who's here. I'm sure they will let me know your question and how to reach you back so I can respond to you. If you wanted to email me, my email is clazaro@vmrc.net. That is clazaro@vmrc.net. Again, thank you so much for inviting me, and have a happy new year, everyone. Stay safe and healthy. Bye.